Over 17 million South Africans are now fully vaccinated against COVID-19, and health authorities are pushing to ensure that even more of the 40 million adults get the jab. But why are so many people hesitant to get vaccinated? Professor Veronica Yukerman from the University of Pretoria joins me now to discuss this matter. Prof, thank you so much for joining us this morning. Perhaps let's start with that million-dollar question. Why do you think there's still so much hesitancy among South Africans to get the jab?
Good morning, Faith, and to all your viewers. That's a complex question, and really that's what we're trying to unpack here. And I think there are various factors that contribute. I think there's still a lot of misinformation and decontextualized information. There's still a lot of fears around how the vaccine was developed. And there's certain, just frank misconceptions around vaccination. And what we really need to do is, at an individual level, unpack what these issues are. And perhaps in the forums that we need to do this is where trust relationships are already built. So where there are already relationships with health practitioners, people that we trust, rather than just large institutions, we can unpack these issues individually. But I think it's really multifactorial. There's cultural issues. Sometimes there are religious objections that people might have, and certainly a lot of misconceptions still around the vaccine.
So then, Prof, in light of the fact that we've got a lot of the mass vaccination campaigns that are underway, time and time again, government will say we're going on a Vuma vaccination drive, and they will try to be in certain provinces to promote getting vaccinated. If you have to look and assess the situation, are we actually making headway? Are those campaigns effective?
I think those campaigns are partially effective. If you think of, for instance, accessibility to vaccines, that has certainly increased over the last months, and even registering on the EBDS initially was a lot more difficult than it is now. We're accepting walk-ins, but they're not having the kind of effect we're hoping for. And that is why, in that recent article, we were looking at issues regarding how can we reach the community at the community level. From our side at the University of Pretoria, we've had certain engagements with businesses who've asked us and approached us and really unpacked with individuals what their concerns are, what their fears are. And perhaps that's what we need to be doing. Maybe we need to be looking at community leaders who are trusted, religious leaders that are trusted, and in the community, members who can really relay information to the community rather than just big campaigns. Not that they have been without effect. I mean, there has been some success in those campaigns.
Yeah, I mean, it speaks significantly, Prof, to the need to decentralize the responsibility of getting the message of vaccination or vaccinating across, that it shouldn't be just coming from one point, but rather understanding how to maybe democratize information sharing when it comes to the way in which we've been handling this vaccination campaign. Especially if people don't necessarily trust the politicians, then they can trust their community leaders.
Absolutely, you're correct, and I love the term that you've just coined there, because that's exactly what we need. We need people who already have the trust of the community, and those can be the vaccination champions. You're much more likely to believe somebody who's been there when you've really needed them and who you've had a relationship with than merely just campaigns. You're absolutely right.
Yeah. What do we do about the internet? Because a lot of this information comes from the internet, a lot of the misinformation comes from the internet, and we know where people spend a significant portion of their time, and that is on their mobile devices getting some kind of information. I mean, is there any way of filtering, regulating, or even putting a little bit of a heading saying this information is not necessarily verified? Maybe then the question is that do we currently even have the infrastructure to allow for almost the synchronization of information, especially when it comes to a pandemic?
Yeah. That's a very good point. We need these platforms. We need platforms where you can get reliable and safe information. So at the moment, the NICD really is such a platform. Yeah, you're right. You can put anything on social media from, I grew 2 heads after the vaccine to actual real information. So we do need some, I wouldn't even call it censoring, but just some quality control in terms of the information. But even when correct information gets out there, I think it's important for people who are not necessarily in the medical field to have a platform or have a forum where these issues can be unpacked and explained in context. some of the side effects, for instance, some of the concerns that are very real, and we've been transparent about them, but to contextualize them, for instance, compared to the complications of COVID-19, that would be fantastic. Because if I think of areas where I have no expertise, such as engineering, if I go and look at the internet now, I have no means to filter really what is true science and what is a miscontextualized science and what is just blatant lies.
Prof, we'll leave it there for this morning. Thank you so much for your time. Professor Veronica Eukerman from the Department of Internal Medicine at the University of Pretoria, just shedding some light in terms of what do we do about vaccine hesitancy that still has a significant portion gripped in society.